morning, everybody. So today, me and Jared are going to talk about spondylolisthesis, some different interventions that we can do for these patients in the clinic. So our objectives for today is students will define spondylolisthesis, students will learn impairments, problems that correspond with this condition, students learn interventions for each impairment/problem depending on the phase of healing they're in. So a quick recap. So this is basically an anterior slippage of the vertebral body, usually in L5 to S1, just like the presentation of spondylolisthesis. Yes, the other one that we just presented with, and this can lead to lumbar joint instability.
All right, so the first impairment that we're going to address is decreased strength and endurance at the lumbar region. So for the max protection phase, some interventions that we're going to implement is supine glute sets and posterior pelvic tilts. And the explanation for this is we're looking to abate pain, engage core and lumbar stabilizers, and low impact positioning to help prevent further slippage of the vertebral bodies. Next is the moderate protection phase. So for this, we're going to utilize interventions such as seated marching and glute bridges. So this is just to promote core, gluteal, and lumbar stabilizer engagement for strengthening and endurance. Then lastly, in the minimal protection phase, we're going to use our interventions are going to be the plank holds and Superman holds. And so this is just to continue to strengthen the erector spinae, core, and maintain reduction of shearing forces on the lumbar spine. So now we're going to demonstrate those. Got some pictures right there. So I'm going to have you take a seat on the side right there for me. So we're going to start with the posterior pelvic tilt. I'm going to bring Charlie out so we can kind of help explain to our patient what exactly we're going to be doing. So you don't want to do an anterior pelvic tilt because this is going to increase the lordosis of the lumbar spine and just apply more strain, and it could, worsen symptoms, exacerbate symptoms, and it could also make the slippage worse. So I'm going to show the patient right here what you're looking for. So this would be an anterior pelvic tilt. You don't want to do that. You want to tuck your bottom, roll your hips forward like that, and engage your core. Okay. So now we're going to perform that. Have you lie down on your back. Get your leg right here. All right. And you can lay flat, the legs straight. All right. So now you're going to do a posterior pelvic tilt. You're going to squeeze your core, squeeze your glutes, kind of roll your bottom forward. Yep, kind of like that. Good. All right, so that's the posterior pelvic tilt. And you also want to just educate your patient, as Dr. Carter mentioned earlier. Just as we go throughout our other interventions, you want to try to maintain this position. And also, whenever you're at home, you can, if you start to have like symptoms, you can put yourself in this position. It should help relieve your symptoms. Okay. So next is the gluteal set. So for this one, I'm going to educate you on this one to squeeze your bottom together, like you got a $100 bill between there. Okay, there you go. So you hold for about 5 seconds. There you go. And then relax. So that's the gluteal set. That's a good isometric exercise for the glutes. All right, so while we're in this position, we'll go ahead and do the supine bridges. So go ahead and bend your knees up for me. So right here, again, like I said, you want to maintain that posterior pelvic tilt. So squeeze your core and squeeze your glutes, and I want you to lift up off the mat. Good, back down, good. So that's the supine bridges. So now you can take a seat on the side. Let me turn this way. Seated marches. So same thing with posterior pelvic tilt. Squeeze the core and the glutes. Bring one leg up towards the ceiling at a time. Good. There you go. So this is a good one for the core stabilizers, also for the lumbar back right here. All the muscles are back there. Multifidus, lumborum, erector spinae, all that stuff. Good. All right, get back right there. All right, so now I'm gonna have you spin back around on your stomach. Sorry. All right, so now we can go ahead and do the Supermans. So on this one, you're going to raise both arms and both legs, squeezing the core. There you go, squeezing the glutes. There you go. Just give me a couple more. There you go, that's good. All right, next we have the plank holds. So have you come up onto your elbows, squeeze your core, squeeze your glutes, come on up. Yep. Good, just like that, flat back, good. All right.
All right, so for the second impairment, we're going talk about is we're gonna kind of gonna focus on the core, so decreased strength and core endurance. So the first thing we're gonna talk about is in the maximization phase, we have abdominal hollowing, also known as the drawn-in maneuver, and you can also do abdominal bracing. So the explanation for this, it activates the transverse abdominal muscles, creating gentle contractions to help with the posture square. Still out of breath for the exercise? For the moderate protection phase, we can do some diagonal curl ups or some bilateral straight leg lowering. So the reason I say lowering because for this condition, it's known to have adaptive shortened hip flexors. So as you're going down, you're eccentrically loading the hip flexors to extend them out. And during the minimum protection phase, you're gonna do some curl ups on an unstable surface and reverse planks with leg lifts. And if you can't do that, we just do the planks without leg lifts. So hold it and come back to it. And this exercise will help the patient utilize the core muscles and upper extremity to help with back mobility, such as scooting in the supine position. For the maximization phase, I'm going to show you abdominal hollowing since we learned about bracing in the beginning. So for abdominal hollowing, you're going to find the ASIS because we're trying to locate the transverse abdominis, and it's a deep core muscle. Okay, so I find ASIS, it's going to be deep, so I'm going to put some pressure there. And basically, I'm going to ask my patient to kind of suck his belly button into the mat while breathing in and out, so inhaling and exhaling. All right, so breathe in. As he's breathing in and breathing out, you should feel a taut band across the abdomen area. That lets you know that the transverse abdominal is intact and it can't contract. So we're just working on contraction. So suck it in, breathe out. And then once it gets to 1 you can hold it for a second to iso-contract it slightly and then relax it. And this is a good one for the maximum protection phase because it doesn't usually do too much pelvic tilting, not that much movement here, just a little activation of the transverse abdominis. For the moderate protection phase, he can also do some diagonal curl ups, so you can bring your knees up to 90. So it's basically like regular curl ups, but instead of going straight up and down, you're gonna go to the opposite leg. With this arm, you're gonna come up and go that way. This side, you're gonna come that way. Good. To kind of strengthen the endurance, you're gonna ask him to hold if you can. So get to one, hold for 3. 1, 2, 3. And slowly come back down to control those abdomen muscles. 1, 2, 3. Slow. Good job. For the bilateral straight leg lowering, you're gonna extend those knees, bring your legs up to 90. That's perfect. I'm gonna help you out a little bit. So I want you to come up and then slowly lower your legs down. Okay, bring back up. Just slowly come down. So I'm gonna move my hand now, okay? Come back up. Slowly come back down. So like I said, I like the lowering portion because, like I said, this condition, because they're in, they usually have adaptive shortened hip flexors, so they're most likely going to be like this. So as he's lowering, coming down, he's eccentrically contracting them, elongating them to kind of stretch them out. All right. So for the minimum protection phase, we're going to do reverse planks with leg lifts. You can do it. What you do? Make sure that since this is kind of narrow, you want to make sure you're close by your patient just in case they fall. So, all right, I want you to lift your hips up. Good. Are you able to lift one at a time? Ooh, all right. Good, so you can relax. So, like I said before, this will help patients if they have when they're scooting in bed. That's why this becomes a functional exercise.
All right, so for our third impairment, we have a forward-leaning posture. For interventions for the max protection phase, we have prone lying on elbows, supine, knee to chest, pelvic tilts against the wall, joint manipulations. You can also do like some soft tissue, like on the hip flexors and stuff. So explanation for this, we're just putting emphasis on pain management, core stability, and pelvic positioning. So next we have the moderate protection phase. Our interventions as bird dogs, standing wall angels, and also standing rows and shoulder extension with TheraBand, with emphasis on posterior pelvic tilt. Putting emphasis on core and upright posture strengthening and reduction of forward flexion. Also for the minimal protection phase, our interventions will be plank with hip extension, reverse lunges with thoracic extension, and banded Romanian deadlifts. Putting emphasis on strength and endurance of the posterior chain. All right, I'll have you start with the laying prone for me. All right, so we'll start, come up on your elbows right here. This is kind of like a low-level plank progression. That'd be good for the maximum phase. Squeezing the core and the glutes. Yep, there you go. Good. So that's the prone plank on the knees. So next I'll have you flip over on your back. A little stretch right here. So bring your knee to your chest, either one. Good. So I'll kind of help right here. So this right here is stretching the hip flexors on the opposite side that her knee is up. So on the right side, stretching the hip flexors right there. You all right? You kind of help them straighten their leg towards the mat a little bit if they can tolerate it. Good, relax. So that's our maximum protection phase. So flip over on your stomach. So for the moderate protection phase, we're going to do the bird dog. So on this one, you have to come up on your hands and knees. So we're going to raise opposite arm, opposite leg. So you can go left arm, right leg. Yep, there you go. And switch it. Good, squeezing the core. Good. All right, good. So that's the bird dog. Next we'll do the wall angels. So if you hop up and come over here. Wall angels. Make this work right here. Okay, so right here. All right, so you're gonna have your arms up against the wall. Just come straight up like this right here. Slide up the wall, okay? Good. Couple right there. All this stuff is to help promote an upright posture and kind of get them out of that forward flex posture. Good. Get that one more right there. Good. All right. Next, we got the Romanian deadlifts. So we're gonna do this with weights instead of a band like I had in there. So this one, gonna want to try to maintain that posterior pelvic tilt still. Have the weights in front of you. Just kind of slide it down your leg. Back up.
What are you instructing your patient to do with the knees?
Slight bend in the knees, yeah. And you're hinging at the hips, yeah. Kind of slide it down your leg. Good, good right there. This is good. Just strengthen the posterior chain right there. Glutes, hams, all that. There you go. Perfect. All right, last one we got is a reverse lunge. So for this one, just doing a lunge, backward lunge right here. Okay. But we're gonna emphasize thoracic extension right here too. So feet together, step backwards. Good. Good, just working on that upward posture right there. Good. Great, got it. Good. All right. There's our resources. You have any questions?
Yeah.
We start left from right.
Okay.
See you.
I have a question.
Okay.
I know that the posterior tilt is a very important part of the exercises, but what happens, what tactile or what kind of cues would you give to a patient to make sure that they're not excessively posterior tilting?
Yeah.
That's how I like clinicals. So when I was in clinicals, a tactile cue they was telling the patient they had them understand was suck your belly button into the mat as far as you can. So once you breathe in, it's kind of like a something like a metaphor and stuff like that, so they understand. Oh, I'm supposed to bring in my stomach and release it.
What's the way to regress the bilateral leg raises?
Bilateral leg raises. when you did the reverse plank.
The reverse plank was what it is?
When Jared was on his back and you were lifting both legs and slowly lowering them down.
Oh, yeah.
Yeah.
I'm talking about when you were lifting both
Yeah,
of them up.
the leg lifts up. A way to regress it, you said?
Mm-hmm.
I would regress it by changing the angle. So don't go as high as like 90 degrees because you could supposed to go back 90 and then drop down. But the lower the angle of your hips, the less you'll have to work and contract those muscles.
You could also like bend the knees up. That'd be like less strain than having the legs all the way out, having the gravity on your whole legs.
I think it was Ed that presented on it, but could you differentiate abdominal bracing versus abdominal hollowing again, please?
For abdominal bracing, it's almost technically, when I did my reading, it was almost the same, but it just seemed like you're including more breathing, I think. Like you're supposed to alternate breathing with maneuver, and you actually are finding the transverse abdominals, and you're actually feeling it when you breathe in and out. You can feel a tight band go across your stomach when you palpate the SIS.
Yeah, the abdominal brace is just more like just straight isometric for the rectus abdominals.
There's no focus. There's no muscle that's really focused on the bracing versus the abdominal maneuver. It's actually focusing on the transverse abdominals since it's so deep.
So I got a comment on that, and so I find this a lot, and I think a lot of people use the terms abdominal bracing and drawing in, or abdominal hollowing, they use them interchangeably. They're really not, okay? So with abdominal bracing, you are engaging, so what abdominal muscles do we have? Rectus abdominis, right? The obliques, okay, transverse. So you're engaging all of that. So I want you to guys, just as you're sitting here, think about, even sitting in this position, think, engage all those muscles, okay? Do you feel how when you engage those muscles, and you especially feel that rectus kicking in, that it wants to pull you into this position, right? It creates that posterior pelvic tilt. So that's abdominal bracing. You're bracing everything. Like somebody's gonna punch you in the gut, right? You're bracing, okay? You're using all those muscles. Versus the drawing in maneuver, just like you said, it's more of an isometric of the transverse abdominis, okay? And so I find that the tactile cueing is very helpful for patients. So I will do this, and then I will have them put their fingers just inside their ASIS, and I will have them drawing. And a lot of times I will use that cue. You're gonna draw your belly button in like you're pulling in towards your spine. And you should be able to do that without moving your pelvis, and you should be able to do that, still talk, still breathe. Breathing is very important with all of these exercises. You've got to be able to breathe and get that diaphragm doing what it should. But one of the best cues I've ever heard too is like you're putting on a pair of pants, they're 2 sizes too small. And like you're trying to button or snap your pants, okay? Because that's right about where transverse abdominis lies. So that's a good cue for that. So a lot of times when we're using drawing in, we're using that and we're not going necessarily into a posterior pelvic tilt, but we're trying to hold a neutral position in the spine. So they're not all the way flexed, they're not all the way extended, but they're in between, and they're engaging, drawing in to try to hold that. And I will do that with breathing. That's a great place to start max protection phase, and just drawing awareness to that, and then you are incorporating that into all these other exercises that you're doing. You know, if a patient is doing a Pallof press or any of these exercises, you're engaging that and incorporating that to your dead bugs. You know, those other exercises where you may want them to keep a neutral position in your spine and drawing in. The drawing in is really good for that. Does that help to clarify? I think it is important to understand the difference and what you're trying to accomplish with both of those. They're different.
In the literature too, it said that the patient will not progress, and this is Kobe and Kaiser, by the way. These 2 individuals should be like tackled and understood before you can even move to this.
Yes.
So that was a key point that it said in the book. Because if you can't control those rectus abdominis muscles, you're not gonna be able to do curl-ups. You're not gonna be able to do none of that stuff.
I got a good illustration for you. You guys can. I'm gonna get it right. So, all right. So y'all know I have some laxity, right? I've got some laxity. I'm very hypermobile, and my core is Jessica from People List the other day. So let's say that we know the hip flexors are attached to the spine. So if I march, right, my hip flexors can engage, and then what's it doing as I lift? How's it working? Eccentric. So it's just tugging on my spine, right, my vertebrae. So I want to illustrate this like this. If somebody got up here and felt, you could feel my back. So if I don't draw in, engage my transverse abdominis, I want you to listen. Can you hear that? Okay. Now I want you to listen to the difference when I engage. Okay, so I draw in. It's a little better, but it's not great. But can you, if you feel, you can see this on your patients. You'll see these